Benign prostatic hyperplasia, also known as BPH, is something where your prostate becomes enlarged in the non-cancerous sense. It affects over 50% of men over the age of 50, and it only affects men, of course, because only men have a prostate. So what exactly is BPH? What causes it? What are the standard medical treatments? How do they diagnose it? And what are some natural lifestyle diet modifications we can make and natural supplements that we can take to reduce the symptoms of BPH? Well, when we talk about BPH, again, benign prostatic hyperplasia. Benign, it's non-cancerous, right? It's not a metastatic type thing. Prostatic, the prostate. Hyperplasia is the overgrowth of the prostate, excessive cell production, excessive growth of that prostate. And the prostate's job is two major things. What is a muscular gland that sits just behind the bladder in men at the proximal portion of the urethra, which it surrounds. Now, as a gland, it produces a fluid that makes up a portion of semen, right? That's one thing that it does. And another thing that it does is it contracts, the muscular portion of it contracts to help expel that semen through the urethra out of the penis for ejaculation, right? And so this can get larger over time. Now, they don't know the exact cause of BPH, but again, there's a major prevalence, right? Over 50% of people, men over the age of 50. So what are some signs and symptoms of BPH? Well, if you have the frequent urge to urinate, especially at night, if when you go to urinate, it's kind of tough to get it going, and when you get it going, it's a weak stream, it kind of trickles out, you feel like you didn't fully empty the bladder at the end, you got to keep trying to push to get a little bit extra out, it takes you a long time to pee. These are all symptoms of BPH. Now, in terms of diagnosis, what they do typically medically, well, of course, they examine your symptoms. They do a medical exam. They'll do a digital rectal exam, often a DRE, and sometimes they'll even do a urinalysis to differentiate BPH from, say, a urinary tract infection or renal disease, aka kidney disease. So what is typical medical treatment for BPH? Well, what they'll do is they'll give you things like, they'll either say, all right, it's not a severe case, let's just do some watchful waiting here and kind of see what happens and talk to us if the symptoms get worse over time type thing, right? Let it try to self-resolve, see what happens there. But majority of the time, they'll give somebody something called an alpha blocker or an alpha reductase inhibitor. Now, alpha blockers will relax that muscle in the prostate, right? And they'll help to relax it and let the urine just flow through the urethra less restricted, even though the prostate has been enlarged, right? An alpha reductase inhibitor is something that reduces the conversion of testosterone into dihydrotestosterone, also known as DHT. Higher testosterone levels often can be associated with an enlarged prostate, interestingly, right? Now, if it's a last resort, they may go to surgery and remove the prostate itself. But this is really risky, guys, because, we definitely don't want to get here because, it could cause things like erectile dysfunction, right? And no guy wants that. It's just not a good thing. And so before you do that, let's do some diet and lifestyle stuff. So what do we got for you? So when it comes to, first let's talk about, who typically has BPH, albeit we don't know the cause. There are some associations here. We know things that increase your risk for having BPH. One of them is obesity. Another one is metabolic syndrome, which is comprised of a few different things such as high blood pressure, high amounts of fat in the blood, insulin resistance, excessive fat around the midsection, right? Increased waist circumference and BMI. So these are all things that make up metabolic syndrome. We don't want to be overweight, right? We want to make sure that we're eating a healthy diet. We want to make sure that we're exercising. Inflammation is also associated, increased inflammation and oxidative stress by free radicals, right? Damaging our cells and inhibiting their function is associated with BPH as well. So we would love to reduce inflammation. We would love, again, to lose some weight. We would love to exercise and have a healthy diet. Something, in terms of diet that could be good is a plant-forward diet, for example, they've recommended. That's shown some promise with BPH. And a plant-forward diet just means it's plant-based, but you can still have meat, just in lesser amounts, right? Now, that's not how I typically eat. I eat a good amount of meat. but I have plenty of vegetables as well, and fruits, low in the glycemic index, of course, right? So when it comes to natural supplements, what do we got? Well, saw palmetto. Saw palmetto is definitely number one when it comes to BPH, reducing symptoms, improving outcomes in people with benign prostatic hyperplasia. It's the only supplement really showing benefit in this regard in human clinical trials. And that's extremely important because, albeit these things can have all sorts of effects on mice, we want to see what they do in humans, right? So saw palmetto is probably my number one. You also have stinging nettle, you have pygeum, you have pumpkin seed extract would be another thing, and garlic could also be beneficial. Now remember, we said you want to reduce inflammation, right? So you would like to have things that are rich in what are called polyphenols, for example, and these phenolic compounds are anti-inflammatory, antioxidant in nature, and you find them in many different types of fruits and vegetables. Now, when it comes to supplements you can take that will be richer in polyphenols, you have things like soy isoflavones, for example. You have things like resveratrol, right? Green tea extract would be another one. Lycopene would be another one. You find high amounts of that in tomatoes. And flaxseed would be great as well. Now, there's also something called beta cytosterols, which basically a beta cytosterol is an herbal mixture of different plant compounds, and then a cytosterol is a type of phytosterol, which is just a fatty substance, a type of fat that we find in plants. And this could help to reduce inflammation of the prostate and improve outcomes. So that is what we got for you guys. If you have BPH, I hope you don't, but those are some natural things that you can do to help alleviate symptoms. Let's see what we got on here. Say what's up to the people. We're gonna go. Allie, how you doing? Shax, what's up, brother? What's going on, man? Happy Friday. Hope you're having a great day. We're here at Wen Wellness. We were just treating patients. I'm sure you were treating a bunch today too. Erica, how you doing? Buchers Collins, I love you. Thank you. Mitch, oh, this is great. Thanks, man. Gino, what's up, man? You want to play some poker later? Tell Natalie you don't got to study all that much. Play a little poker. Get your priorities together. Yeah, that's good she's studying, but let's play poker for real. Drew's Clues, what's up? Bon voyage. Baker Manson. Dad Lovers, how you doing? Mikey, Stephen Apple Blue, Moonbow Rattle. What's up, my man? Don Spice, Master Dave Ashton, he's the beast from the east. How you doing, killer? Nice to see you, man. Master Christer, Bull City King, Teague Muscle, Rendaz P, and Edwin Eddie Rodriguez. OG up in here, that's for now. So we got for you folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great one. Thanks a lot. What's up, Jacqueline Taylor? Thanks for coming on, and happy Wen Wellness. We'll see you guys tomorrow. Thanks.